My name is Professor Nick Maynard. I'm a consultant surgeon at Oxford University Hospitals in the United Kingdom. And I'm in Dublin for the weekend, having been invited to talk at Trinity College today at the Irish Street Medicine Symposium. And I was asked to give a keynote lecture about my experiences in Gaza during the current war. And my talk was entitled Gaza, a War Against Healthcare. So I gave that talk this morning describing my experiences in Gaza and particularly focusing on the targeting of hospitals and healthcare professionals in Gaza by the Israeli military. So I've been going to Gaza for 15 years now, since 2010. For many years teaching. Every year I take a group of doctors out to teach medical students at the Gazan universities. But in recent years, I've also been helping them develop their cancer services, particularly their cancer surgery services, because I'm a cancer surgeon in Oxford. But over the last 20 months, since October the 7th, I've been out there on 2 trips. I'm going out again for my 3rd trip shortly to work in the hospitals there, helping with surgery of all the trauma victims there. And that really is the essence of the talks I give. And having seen such appalling atrocities, I've felt this sort of overwhelming need to share what I've seen, because it's not being reported by the media, it's not being reported by our governments, and I feel people need to know the real truth about what's going on in Gaza. And I think it's fair to say I've seen things that I never would have expected to have seen in any healthcare setting. I've seen about 70% of the patients I've treated, both in the emergency room and in the operating theatre, have been women and children. I've seen appalling injuries in children, terrible burns, many children with traumatic amputations of 1, 2, sometimes 3 limbs. I've seen children who've been shot in the head, shot in the chest, shot in the abdomen. And the predominant injuries I saw were terrible bomb blast injuries from the fragmentation missiles that the Israeli military use, which are bombs with thousands upon thousands of small metal pieces, which tear through everyone within 50 to 100 meters of the bombs. So I saw awful things and images that I will never forget. And to my eye witnessing, I saw what I am in no doubt are multiple war crimes, particularly the targeting of hospitals. I was in a hospital operating when it was bombed, when the intensive care unit was bombed next to the operating theatre I was operating in. There have been many examples of hospitals being bombed and many examples of healthcare workers being killed. And also friends of mine who've been abducted, illegally detained and tortured in captivity. Some of them have been killed as well. So I've seen awful atrocities, and I feel absolutely compelled to share my experience, to make sure that people in the West hear about what is really going on, because our governments are not telling us.